I'm Louis Appel, Chief Medical Officer for People's Community Clinic. At People's, we provide many services that are outside the scope of regularly funded healthcare. We've built programs and services that really speak to the needs that people have more holistically in their lives. That includes services like mental health, behavioral health services, nutrition and lactation services, health education, chronic disease services, medical legal services related to health harming legal needs. So we really try to look at the whole person and be able to be supportive of them in their lives in whatever way that they need.
My name is Fred Blackman. I'm a minister at New Life Austin, and I'm also on the board of directors here at People's Community Clinic. As a minister, I do several things, from teaching classes to visiting people in hospitals and nursing homes to, of course, preaching sermons. I became a patient at People's Community Clinic after a stay in St. David's Hospital. I was in the shower getting ready for work, and I felt a sharp pain in my back, and then my legs collapsed from underneath me. I was rushed to the hospital where they determined that I had a slip disc shoot out and hit my spinal cord. After about 5 surgeries and several other procedures, I was released. During that time, I lost my job and I lost my insurance. And the doctor who released me recommended that I come to People's Community Clinic for my follow-up.
When I first met Fred, he had just come out of the hospital. He had some severe back pain. He went in the hospital. 9 months later, he came out having to learn how to walk. He had to learn how to speak so his words weren't slurred. So he was depressed. He was unsure of which way to go.
When I arrived here, my life had basically been flipped upside down. I had always been strong. I was a runner. I was an athlete. And in an instant, all of that ended. And People's Community Clinic really helped get my life back on track.
For patients who have complex needs, I think we really take a team approach and an interdisciplinary approach. We have a whole array of wraparound services that we can provide and offer to patients depending on their specific needs.
The reason why I love People's Community Clinic is because we're an integrative clinic. And a lot of people may not understand what that means, but to me, what integrative health is putting the patients at the center and looking at all the factors that influence their health. It's not just medication, it's not just injections or surgeries. If you look at what the evidence shows, first-line treatments now for complex chronic pain or for pain in general are things like acupuncture, behavioral health interventions, chiropractic and yoga. These things are actually now your first-line therapies. We're able to incorporate some of these in to actually create a program that can really benefit patients.
I don't think that a regular quote-unquote doctor's office would be prepared to meet the needs that I had. A regular doctor's office doesn't have a counseling department. There's just a doctor's office. And even now, working with the pain group, it's a group of people who have chronic pain. And we work together in this group with Dr. Sharad and other counselors, and we talk to one another, we encourage one another, we learn from one another. It's just an all-encompassing level of care that you can't receive anywhere else. Without People's Community Clinic, I don't think that I would be walking and talking and living life like I live life now.
There is an emerging evidence base that demonstrates that our health is made up of so much more than medical care. Texas has the highest number of uninsured people in the country. For many Texas adults, it's not enough just to have coverage, though. There's the whole other question of whether the insurance company will actually pay for the treatment that's been prescribed by the physician. In Fred's case, informal advocacy was actually enough because the insurance company was on notice that someone on the team knew how to operate within all of the systems. When we see people as whole people and treat all of their needs, then we enable them to go out and live their life at its greatest potential.
One of the privileges that I've had working at People's has been the diversity, the people that I've gotten to know that I normally wouldn't. And they deserve a place where they can go and feel safe and valued and cared for. And they deserve the exact same treatment that we all do.
Most of health really is not health care. So most of health and well-being is related to the other things that go on in one's life. So the social supports that one has, the context in terms of nutrition and where you're living and what kind of activities and social support you have. All of those things combine to be supportive of or take away from health. And a lot of that is things that happen not in the context of just a medical visit.
In my normal day-to-day work as a minister, I meet with a lot of people, and some of them, they need help that I can't provide. And when I can't provide that help, I'd say I know who can, and it's People's Community Clinic. Because of the care I've received at People's Community Clinic, I am better able to help others, whether it's through referrals to the clinic, by sharing my story, or just because I'm the better person that I am because People's Community Clinic has helped me. I am able to help others, and that really makes me happy.